How can we go forward with this?
I want a 6 month off.
Maybe you need that.
And then my brother killed himself. And I went mad.
You say that you're having thoughts at the moment that you don't want to be here. Have you taken that one step further? Have you started thinking about doing something silly? What have you been thinking about?
Swallowing all my meds.
Is that a wig you got on?
A wig? Does it look like? Feel it?
It was lovely.
So I know you've had problems with drugs and things.
Yeah.
Have you had something today?
Yeah, just one thing up. Just one thing and another, basically, yeah.
Take a seat for me.
This is my first time here.
Oh, well, welcome.
Because I had to transfer over from, I was at Streatham,
Okay.
so I had to transfer over.
Okay, so let's just have a chat about why you've moved, what's
Yeah,
been
yeah.
going, because I don't know much about you yet.
So it's okay, the can's not open.
Okay.
It's not open, I promise
Okay.
you, it's not open, it is closed.
Okay.
I'm a registered alcoholic, I've got cirrhosis of the liver.
Okay.
I'm allowed to drink, I cut down from 8 cans a day to 3 cans a day.
Well done.
Drink 1 in the morning, 1 at lunchtime, and this one. But I wake up at 5:30 and I'm like this. Seriously, I couldn't make a cup. I'm like this at 5:30.
Are you?
I am, I'm like this. I couldn't make a cup of tea or coffee. I have to go to the shop and get a can. And I'm okay, once I've had that first can, bang, I'm back to normal. I mean, I've had 2 today, I wouldn't lie to you.
No.
Don't have to lie.
Yeah.
But this is my 3rd one. Whether I touch it or not is a different matter. Sometimes I don't. Sometimes I just have 2. But what it was, I was homeless for quite a while
Okay.
after my breakup. I was with my partner for 23 years. And then, she pissed off with my best friend, which I found very hard. And I ended up in mental wards and everything, because I couldn't handle it, you know. Because I had 4 children with her. This year, be 6 years.
Okay.
And then my brother died. My brother killed himself.
Good. Gosh, okay.
My only brother. And I found that destroyed me.
Absolutely.
So, one minute I was coming up, getting over the separation. I was okay. I got over what she done to me and whatever, and obviously I couldn't see my kids and all that. I could see them, but once a week.
Okay.
But then all of a sudden he killed himself, and I went mad.
You can't do next week Monday.
Nothing for today, I'm afraid.
So I don't know if I spoke to you about my results.
You didn't, but I've seen on the notes
Okay.
your iron levels are quite low.
Absolutely, and it's more about the hair thing. So how it all came out was I was walking and all of a sudden the wind blew my hair and my husband said, "Oh my gosh, you've lost loads of hair."
Okay.
And actually having subsequently had that, I have really thick hair, and then I've now noticed that whereas, it's a fraction of what it was.
It's a bit thinner than
Yeah, and I just wanted to make sure it was
Let's have a look. Okay.
that bit.
Yeah, okay.
Because I'm worried, because probably when I was about 16, 17, I had alopecia.
Right. Over a small area of your hair or affecting a lot of your scalp?
It didn't, I mean, it wasn't, I didn't need to wear a wig or anything. Maybe it was even 18 because it might have been when the university, you know, A-levels were happening.
Right, okay. So you have, I don't know whether you've managed to see in the mirror, because it's an awkward area, probably the size of a small plum, sort of that sort of size.
Okay, yeah.
And there's some hair that is growing. It's not completely without hair, but it's definitely much, much significantly thinner than anywhere else.
My husband did try to photocopy it. Photograph
That would be challenging.
Yes, absolutely, wouldn't it just?
Just check on.
Yeah, but it does feel a lot looser and thinner.
And you had the blood test and it showed that you're low in your iron.
Yes.
And Dr Glynne has given you some iron tablets,
Yes,
is that right?
indeed.
Okay, and you just started taking them.
Yeah.
So it is alopecia areata, which means you've got a sort of area patch of reduced hair. And it sounds quite similar to what you had when you were 18, 19. And also the natural course of alopecia areata, like when you were younger, is that the hair growth normally does come back, and it can take a couple of months to come back.
Okay.
But that's what we would expect to happen.
It's only that, you know, as you can appreciate, I think for everyone, whether it's male or female,
It's
such a sensitive thing. I didn't think it would upset me so much, but it did.
No, but
Okay.
sometimes what they can do as well is you can sometimes get some steroid, which can help, either steroid cream to put on every single day, or sometimes little injections can be done which will promote the hair growth to come back.
Okay.
Very often alopecia is actually we think is an autoimmune condition. So it's your own blood cells, your own white blood cells are for some reason attacking your hair follicles. There's a bit of inflammation, and then the hair can get a bit thinner and it can fall out.
Okay.
But it does grow back.
And how much were you drinking at the time?
To be honest with you, and I wouldn't lie to you, 2 bottles of brandy and 8 cans of lager, strong lager,
Okay.
a day.
Goodness. Okay.
No, not Guinness.
I said goodness, but
sorry.
you can have Guinness too. When Charlie came in, there was an underlying kind of pressure to tell me a lot of things that he's maybe not had the chance to talk to many people about. And he just needed a bit of a vent or an outlet, and that's often what GPs are.
But now I don't touch spirits, I don't touch drugs because my brother died of that.
Oh really? Is that how did he kill himself?
Yeah, overdose.
Okay. Any alcoholic story, or you know, anyone with any addiction story, there's always these little trigger points along the way. You hear the story and all you want to do is just wish you were at those specific points at those specific times, just to interject and be like, stop, no, don't do this. So what's inspired, or who inspired the turning of the leaf into cutting it all the way down to 3?
IDAS.
Okay.
I went with IDAS with Corey and Vanessa that work at St John's Hill.
Yeah.
We're going through a programme at the moment. And she goes, do you know what, Charlie? She goes, you're perfect. She goes, I don't understand. I said, because I get so angry with everything. She goes, you can deal with it when you need to deal with it. Why don't you deal with it? I said, I don't know. I don't know. Sometimes things hit you, you know, and you just, it's like, and you think, when's it going to stop? But I don't know. You have to stop it.
Yeah.
Only me.
Well done. Have we got anyone looking after your liver at the moment? Are you under anyone?
St George's
You are?
Hospital.
Okay.
They're saying to me, like, you know you can't keep drinking like you can, but you can't stop. Because if you stop, it will kill you.
I'm going to put one in there, and she's going to cry.
Yeah.
Scratch.
Scratch, do some breathing, good girl.
Look up there. Oh, yeah. Right now. All done, Jack, all done. No more, no more. Good singing. Blah, blah, blah.
About to change, isn't it, in a couple of minutes?
In you come. So Mum, have a seat there. Which one's Austin? This one's. Oh, I like Minions. Did Mummy tell you what was happening? Yes, on please. You're going to have a bit of medicine. Do you like stickers?
Yeah.
Do you think you'd like a sticker?
I would like a sticker.
Oh, all right. That one. Okay. So first of all, I'm going to give you a little bit of medicine. Mummy's going to give you a big hug, and then you can have the sticker.
And then
Is that a deal?
Mummy's got the chocolate bars in your scooter bag.
Cool. This is a good deal, isn't it? So Mummy's going to give you a big hug.
Yep.
There'll be a little ouchie on your arm, very quick, okay? Just a tiny bit. So, Mummy, just make sure you've got both his arms pinned down just in case. 1, 2, 3. Sorry. All done. Finish.
Super job. Should we go find those chocolate bars?
Oh,
darling,
finish.
Great.
There you are. Do something to cheer him up, quick.
Quick, chocolate bars, Jared. Grab in the scooter bag. That's it. Oh, good. He did have one. I don't know where he did have one. Bye, guys. Bye. Bye. Bye.
So I can arrange for the nurse to give you a call back today.
So I'm giving you thiamine, vitamin B compound. And are you still taking the chlordiazepoxide? Thing is,
I've still got 10 of them left.
so the main thing for them is obviously to stop you getting the withdrawal symptoms, and that's probably why you're taking in the evening, because you finish your can, you know, at this time, and then you don't have anything else. If it's not done properly, you can end up having kind of tremors and withdrawals and really bad symptoms.
Oh.
It sounds like you're doing it really well. You're managing it perfectly. We do it for a month, and then that way I get the chance to meet you again in a month's time to make sure everything's okay.
Yeah, that's fine.
Fab. So, number for counselling, your thiamine and vitamin B, and ta-da. We'll go from there.
Thank you very much.
No worries.
Pleased to meet you.
You too. Take care.
Bye.
What's brought you in today?
It's basically just my ongoing depression. Basically, it's like I'm not on the sick or anything at the moment, but for the last 12 months I've been with the job centre trying to look for work and that, and I just feel like it's all getting too much. Basically, the pressure and the stress of just trying to find work and just getting back into the routine of you know, trying to sell myself. And when I feel so down and so low, like I feel like I've got nothing to offer.
Okay.
I mean,
when was the last time you did work?
Like the last time I properly actually worked and earned was probably 2005, 2006 maybe.
Okay.
I've got debts just mounting up. It's come to the point where I barely leave the house. Like I've got the bailiffs knocking, so I'm scared to leave. You know.
Right. Do you live with anybody else?
I am, like, on my own. So,
okay. And the job centre,
like,
they're not offering courses or training or anything like that?
I've had the courses that I'm supposed to have attended, but obviously being such a recluse and that, it's really hard for me to get out the door.
What about alcohol at the moment?
I don't drink.
Don't drink
at all.
Okay. And smoking?
I've got a habit.
Yeah.
Like I don't smoke as much nicotine as I used to, but I find that weed is the only thing that keeps me sane.
Okay. And in the past, you've obviously had sort of, you know, big conversations with Carl here.
Yeah, they really don't want to approach any sort of counselling with me unless I tackle the drugs.
Yeah.
But to me, the drugs are a problem, obviously, but they're not the problem, because I was having problems before I got onto the drugs. It's like the drugs literally were a release to stop me, like, you know, going mad and thinking about doing silly things to myself and stuff, and I found that it worked.
I think with William it's very difficult to try and change his behaviours because they're very entrenched. This is a young man who should be productive in his early 30s, who hasn't worked for 10 years plus, and a lot of his situation is very much a result of his substance misuse. And these conversations are often difficult unless that person's ready to make change. They're very unlikely to act upon it.
It's difficult to know what the best thing to do is, isn't it? Because we've obviously been in a fair cycle of it before, where we've just gone down the route of sick note after sick note.
I mean, it was less stressful, but at the same time I also felt like, well, does anyone care about me? Am I just one of the ones that's they're just going to let slip through the cracks?
Lift your arms all the way up. Yeah.
Then all the way back like that.
And the other side. Good. Up. Down.
Arms back. Okay.
Hello. Lauren.
Hiya.
In you come. I'm Sarah, one of the nurses. Have a seat.
Thanks.
Good. So you booked for a smear?
Yes.
Is that right? And you've not had one before?
I had one with a private doctor.
Okay.
I haven't had an NHS one before.
When the doctor saw you, she said you're not sexually active.
I am now, yeah.
Okay, that's fine. It's just sometimes people come for a smear and actually you don't need it until you're sexually active. That's fine. I don't know if when you had the private one they explained properly what it is.
They did, but it was a couple of years ago.
Yeah, do you want me to just run through it? So your cervix is the neck of the womb, the opening to your uterus. So it's at the top of the vagina. There's this bit of tissue which is round with a hole in it, which is where your menstrual blood comes out, where sperm tries to get in, and where it opens up for a baby to come out. Many years ago, cancer of the cervix was a big problem for women because it would develop in that area and you wouldn't know. And by the time it was picked up, it had spread, so it was bad news.
Yeah.
But the whole point is to prevent cancer by picking up these early changes, and those can be then kept an eye on or treated. The smear's a guide, not a definitive test. Even if one did have precancerous cells, they're easily treated. Yeah. Anything else? No. Come over.
Oh, you're here.
No, that's quite well. We're in that area, so to speak. So you need to. You can either take your skirt off or tuck it up, and take your nicks off if you would. Okay. So I want you to concentrate on nice deep breaths. All right. Just keep breathing. Sorry. Breathe. Okay. Just pop your bottom down. Let your legs go. Just concentrate, nice deep breaths in through your nose, out through your mouth. That's it. A little bit more uncomfortable. I've just got to open the speculum to see your cervix. Keep breathing, you're doing really well. I just need
God, can you imagine having a baby? Like? Jesus.
So everything looks fine, just taking the smear now. There we are, have a tissue, just come through when you're ready. So you'll get your result in within 2 weeks.
Okay.
And I'll text you the results.
Great.
Okay, bye.
Hi. Good afternoon, Barry speaking. How can I help?
Hi, Alan. Hi, come on in. Come and have a seat.
Thank you.
How are you?
I'm good, thanks.
Good. Right. So, what's been happening? It's been a while since I've seen you.
Yeah, basically I've gotten what is it? Hep C.
Mm-hmm.
And basically I've just haven't been well at all, sort of thing. And trying to think where it is. So yeah, haven't been well, and just I can't think. Haven't been well. Just one thing.
Have you, because I know you've had problems with drugs and things.
Yeah.
Have you had something today?
Have I had anything today?
Yeah.
No, not really. It was just one thing. One thing. Yeah, just one thing that another. Just one thing that. Just one thing and another. Basically, yeah.
Alan had phoned earlier in the day saying that he was feeling really low and suicidal. So when I was assessing Alan, it was really apparent that there was going to be a limited information I could get from him. It was really difficult in assessing him to work out whether how he was related to his mood and he was really depressed, or whether he'd taken something, or whether there was actually something else going on with his body that needed attention. So you rang up earlier today and said that things weren't going well.
Yeah. But basically, I can't even think.
Where are you living?
Just round the corner, basically.
Who are you living with?
Just one thing and another. Yeah.
Okay.
Yeah.
Are you okay just to stay there for a minute?
Yeah.
I'll be back in a second.
Yeah.
Eleanor, could I ask you to order me an ambulance,
everyone goes home.
please?
Do you know the patient's name?
Yeah, Alan Whittaker.
Yeah.
Currently in my room, but I'm going to put him in the waiting room.
Lovely.
The only reason we called an ambulance was I had to work up a plan that would be the right thing to do by him to keep him safe. As a GP, we can't do tests and investigations. We can't kind of monitor someone and see how they go. So the only option I had really was to send him to A&E.
Come take a seat, Ty. How can I help?
I suffer from depression, bad. And Saturday evening, I was bullied, and it sort of brought back a lot of memories that I had from school, you know. And yesterday, I just totally crashed and just spent most of the day crying.
Right.
I'm exhausted because I'm a bit of an insomniac as well, so this has not helped.
What happened Saturday night?
I was bullied, you know, they just kept verbally abusing, you know, and I said to them, stop, please stop, you know, this is hurting. And they just carried on.
Right. Were you out as a group then on Saturday night?
No, cyberbullying.
Oh, I see, okay.
You know, and it's horrible. It's probably worse than physical bullying.
It's unusual to see an adult that comes in and admits to being bullied. And in this case, he was complaining that he'd been cyberbullied, and that's my first experience of cyberbullying. Obviously, that's on the increase. I suspect it's something that will become more common in my future career. Bullying is very damaging to people's mental health. It obviously knocks your self-esteem, your self-confidence. It causes depression and anxiety, which spills over into all your other areas of life.
The way I likened it to my friend was it's a wound that never heals. You never lose that feeling. It always stays with you. I don't know, I just can't do this anymore.
What stopped you from just turning the computer off then?
I did.
You did, eventually,
Yeah. You have no idea, unless you've been bullied, you don't know how it makes you feel.
Patients come to see you as a professional. They have friends and family and relatives if they want friendly advice outside of the surgery, but the fact that they've made the effort to make an appointment and come to see you, they're looking for professional guidance. And yes, obviously you want to sympathise and show empathy, but equally, while I'm chatting, I'm, as I say, doing a risk assessment in my head, and I've got other things that I'm thinking about and trying to steer the consultation in a particular way.
Justifiably, people are worried. They're like, well, you need to get help, you need help, because a friend of mine asked me, do you feel safe? And I was like, no, truthfully, I don't. I'm having those thoughts again.
Okay.
I just feel absolutely shocking. I feel terrible. I've actually had to give my mother my meds to keep me safe.
Right, okay.
Because I was seriously contemplating it.
Okay.
I don't want to be here. I really don't want to be here. I can't do this. I'm tired of being hurt. I'm tired of being sort of trodden on. I just don't want to do this anymore. I can see no way forward now.
Let's just check your neck, so keep your head still.
It feels quite tender.
It feels tender around here.
Just make sure there's no obvious signs of infection. Oh gosh, sorry.
That's quite sore.
And you can move your neck from either side.
On the other side.
Crunchy.
Does it hurt when I'm pushing down over your neck?
I just don't know what to do. I mean, my mother, she's a pensioner, and she's justified because she's upset. And I was like, well, I'm sorry, I don't want to feel like this. Believe me, I just want to stop feeling like this now. But it's wrecked me. It's wrecked me.
I can see you're very shaky, aren't you?
I'm in a bad place.
Have you self-medicated at all with any alcohol or anything like that over the last... No, you haven't.
No.
And in the past, have you ever tried to harm yourself in any way? What have you done in the past?
I took quite a few amitriptyline.
How long ago was that?
Over 5 years ago. That was the point where I knew something wasn't right.
You say that you're having thoughts at the moment that you don't want to be here. Have you taken that one step further? Have you started thinking about doing something silly? What have you been thinking about?
Swallowing all my meds. Just swallow the lot, go to sleep and never wake up.
What stopped you from doing that?
I suppose it's the people I would leave behind, you know. It got to the stage where it was, right, I'm going to do this. And I sort of lined up all my meds and I was like, that'd be enough.
So you've given all your tablets to your mum at the moment, have you?
Yeah.
Do you live with your mum? Or
Yeah.
do you, yeah? Okay, so what's she done with the tablets then? Where's she put them?
She's put them in her room.
Okay.
You know, I can't get access.
You can't access,
No.
fine, okay. First thing that I'm wondering is, are you a serious risk of doing yourself any harm? In which case, do I need to liaise with psychiatry today, which I'm very happy to do. And then if we don't want to go down that route today, then I think we need to keep a very close eye on you this week. I could perhaps give you literally sort of one sort of half of a sleeping tablet dose just for today, just so to take the edge off your anxiety, to let you go home and get some sleep, to see if that helps, because obviously sleep deprivation makes everything worse as well. And then I'm at work again tomorrow, so I can ring you tomorrow morning, see how you're getting on, and if necessary, we can bring you back in tomorrow lunchtime for a review and take it from there. So what do you think? What are your thoughts about today? How do you feel about managing today?
I just want to sleep.
Yeah. And what about the Samaritans? Have you ever phoned the Samaritans?
Never phoned them, but I do have their number.
Okay, because that's another number you can try if it's sort of 1 o'clock in the morning and everyone else is in bed and you're really struggling. That's another option you can try.
These sorts of patients are the ones that you go home and worry about and sort of just hope that you don't come into work the following day or the following week, and you don't want to sort of receive an email that anything's happened, and that would be devastating to know that you feel that you'd missed something or you could have prevented something. I think it's only human. We're doctors, we're GPs, because we like interacting with other people, and hopefully we have empathy and sympathy, and if you don't have that, you shouldn't be a GP.
Would you like me to give you just a couple of sleeping tablets just for today? I mean, again, it's not a long-term
No.
cure,
I don't like taking them, but
for
I
a day
need
or
to
two,
sleep.
just to try and get take the edge off it for you and see. You've taken your mirtazapine today, have you?
I take it at night.
Yeah. Perfect. Okay. But hopefully, maybe if you get some sleep today, just take the edge off it. You never know; things might settle down a little bit over the next few days.
I hope so.
All right.
Okay then, lovely.
Okay.
All right, thanks
All
very
right, then.
much.
That's a pleasure. See you soon. Bye bye.
Thanks.
So unfortunately I haven't got any appointments available, but what I can do is ask the on-call doctor
At the
to
moment,
give you
it's
a
currently
call.
fully booked until next
okay,
Friday.
Just confirm the number to call on.
I thought you'd be happy to see me. I thought I was your favourite. Oh, thank you. It's a bit wild, isn't it?
No, it's beautiful.
Thank you.
Is that a wig you got
A
on?
wig? Does it look like? Feel it?
Oh, it's lovely. Is it yours, that one?
It is all mine.
Oh, you sexy
All mine.
face.
I've missed you both though.
Yeah, we haven't seen her for a while.
I know. You haven't been going to anybody else, have you?
You're joking. You think we'd not go to somebody else and leave you here?
I know. Okay, so you come for your blood test.
He does, yeah.
Clench your fist.
I like the eyebrows.
Yeah.
I've got a needle in my hand.
Ooh.
Do you like my eyebrows then?
Oh, yeah, they're lovely.
Thank you. There we go. Yeah. I thought I'd make an effort for you ladies.
Absolutely. Come on, just any time we come in here, you're lovely.
Thank you. I do try.
Nice to have a good laugh.
Yeah, it is. There we go.
Yeah.
So it's all done.
It is.
Oh, God, you're wonderful.
Thank you.
She wanted to marry you a couple of years ago, didn't she?
Still can. You still can.
I'm free.
I love you both.
One was enough.
Cheers, boy, you're lovely, lad.
Thank you so much.
Yeah,
Take care.
Bye, love.
Bye-bye. Nice to see you. Bye.
Come and take a seat. And how are you today?
I'm in a better place, but
yeah,
I'm ashamed to admit that I never actually got to see the drug support people. I mean, I literally tried on 3 occasions to go there.
Right.
The first time I went, I thought, okay, if I turn up in the early afternoon, they should be able to, find us, give me an appointment or something. And they told me it's you have to be there for 9:45. of a morning, and literally they've got four spots. So the next time I went down there, I didn't quite get there for 9:45, and literally there was already 4 people there waiting. And if there was an afternoon thing, that'd be ideal for me, because I'm more nocturnal, and like I tried to stay awake the second time so that I could, but then it was super hot. Literally, and it was a wasted journey. I really felt bad coming today, not asking not doing what you asked me to do, and I just thought, well, God, if I can't do what the doctors asked me to do, and the job centre are literally might as well be talking to a brick wall.
I think it's very frustrating seeing patients time and time again who haven't followed your advice and haven't taken advantage of the great services that are available that would support them. It's the same in really any consultation that involves alcohol or drugs. What we need to do is not lose heart and to keep on discussing this with them and trying to think about ways forwards. How can I get him there?
So how are we going to get things going forwards? I think the first part has to be to think about the drug side of it.
I mean, this is all I do. It's literally, I weigh up the pros and cons, and like the cons aren't as bad as the pros to it for me. I mean, obviously, I would like to be like an upstanding member of society and, you know, contribute and not feel like such a burden on the taxpayer and
You sort of said to yourself, you know, more of a night person. I've struggled to get down to the drug and alcohol service, and they're open at 10:30 in the morning. It's too difficult for me, but that's part of that.
That is part of the working process of literally, you need to get up at a reasonable time, right?
So why don't we see you again in a couple of weeks' time, and the next time you come in and you say, actually, I've been down to WC Downs. I was one of those 4 people there, and actually I've spoken to so-and-so, and he's pointing me in this direction, and I'm positive. Because that would be a great thing to hear.
It's true.
The thing you're going to achieve before you see me next time is
get to the outreach centre.
Get to the outreach centre.
Get on their radar.
Indeed. Okay. Take care, and tell me next time that you've engaged with them, and we'll go from there. Okay. Thanks. Take care. Take care.
So work is messing around?
Yes, they're not good. All them doing to me is mess with me. They give me pain in here so tight. And when I try to explain to them, they don't want to hear anything. They shout at you. And when I talk, you know me talk loud. That's how me talk.
Yeah.
I still go.
Yeah.
But I'm not comfortable.
Yeah.
But I try to be comfortable. It's not working, because this minute it's like a bully, and them running me out. Go home and get a paper from your doctor and bring back to me. These things just make me good. I said, why are they trying to hurt me? That's how them talking to me now. So I tried to explain to them, don't shout, don't talk to me like that. I said, that's how I talk. Simple.
How can we go forward with this?
I'm fed up, so
are you quitting?
No. So I need a letter to give them.
You mean a certificate?
Yes.
So 2 weeks from last Thursday, so next week.
I want 6 months off, to be honest.
Maybe you need that. It's very difficult to know if a patient needs a sick note or not. So obviously all we can rely on is what the patient tells us. So it's very difficult to judge the genuineness, if you'd like to put it, of the condition. However, in the past, she'd had a hemorrhage in her brain, and therefore she's worried that when she feels anxious and she gets panic attacks and she feels that surge of adrenaline, that she's going to have another hemorrhage, another bleed in the brain, and that's her main concern.
Oh, God, I'm fed up.
That's the appointment. Okay?
Yeah.
No, look, business. Pain there.
Right. Anyway, last night it was just ridiculous. I could barely breathe, just really tight chest.
You take a big deep breath in, and then you blow out as hard and as fast as you can.
Okay. Just breathe normally for me.
Okay, you pumped it twice. Yeah. Are you going to do it again, or would that be your 2 puffs?
How can I help today?
There's like a few things. First one is my smoking. I've been on and off since I was about 15 or 16. I recently stopped for a couple of weekends and I started again. And I mean, I've got like electronic cigarette,
Okay, so the e-cigarette that you're using, it's got nicotine in it.
Yeah, 18 milligrams. Yeah.
And so you're finding that that's not enough
Yeah.
of a nicotine substitute.
Yeah.
Okay. We have a smoking cessation nurse here who I'd love you to book in with because they follow you up, they give you the right amounts and keep making sure that you're on the right track as such. You said there are a couple of issues.
It's quite a sensitive subject.
Okay.
So obviously all guys masturbate in that. And I was thinking that I might have to get a circumcision because when I do, I can't get the actual outer skin all the way down at all.
Okay.
And when I do that, it really hurts. It sticks. It really hurts and that. So.
Okay.
I will spend my mornings before clinic starts looking through all my patients, just trying to second guess what they might come in with, because then I can kind of prepare myself as to what I want to do for treatment and how I'm going to kind of manage it. And the next thing you know, you're like, whoa, I was not expecting that.
So it's kind of gets stuck halfway down and it's painful as it comes down.
Yeah, when it comes out, like it's as if it has to like pull itself out more to try and like elasticate itself or something.
Okay. It's never kind of bled or been cut or anything like that.
Like not really, no.
No, and like passing urine or all other times when it's not all the way down, it's fine.
I've had a bit of pain like when I've like gone to the toilet and that a few times. But yeah.
Okay. When it comes to kind of the tube being a bit painful, it might be worth just getting an STD check because that can sometimes be a cause.
Yeah.
Do you think there's any risk that you could have an STD at the moment or anything? It's possible. Right. Okay. I would just advise you to pop to a gum clinic to get that sorted. With regards to the foreskin, do you mind if I have a look?
It's totally fine.
Yep, okay. All right, so I need you to pop on over here. And if you wouldn't mind just pulling down your trousers and underwear and just lying on the bed for me and letting me know when you're done.
I find a lot of things embarrassing, but I've gotten a lot better through the years. At medical school, anytime I had to see like a penis, anytime I had to touch a testicle, I would just go bright red. I was horrific back at med school. So yeah, I'm less embarrassed now than I used to be, but I'm sure I go a bit lobster-faced pink at times.
And is it only when it's erect that it hurts? Otherwise, it's fine?
No, in the past, it's hurted without it being erect.
Oh, really?
So, yeah.
Okay. Sorry, I don't mean to.
It's all right.
Sorry. All right, can I have a look at the good ear to start with? Peek at that. So they are both beautifully blocked up with wax.
Seriously? Well, there we go, straight away.
Well, there's no infection in that ear anymore, that's for sure. Look that way.
Is it all right at the moment? I'm so sorry.
It feels a bit sore, yeah.
Does it? Okay. Well, look, that's fine. I'll let you be. I mean, we can certainly refer you to the urologist to consider a circumcision if that's something you'd like to have. It doesn't actually seem particularly tight at the moment.
Yeah.
So, I mean, how long has it been a problem for now?
Do you mean like when I masturbate?
Yeah.
It's been a problem for ages. Yeah, quite a while.
Like years, or?
Yeah, probably years. Yeah.
I mean, yeah, okay. If it's been a problem for years and it's not something that's just new, I can refer you to the urologist and they can consider all of that if you'd like.
Yeah.
Yeah?
I've referred Nathan for a circumcision, or at least to speak to the urologist about it and whether it's the appropriate thing to do. When I examined him, I wasn't entirely convinced that he really needed one. It's mainly more of a symptomatic thing. So if he's getting symptoms, it doesn't really matter what I'm finding clinically, and he can certainly be referred for one.
You'll get a letter in the post.
Okay.
So that's everything,
Cool.
I think. Yes? So that's the list of things you're going to do.
Yeah, all right.
And we'll go from there, all right?
Okay.
All right,
you.
take care of yourself.
Have a good day.
You too, bye.
I'm sorry to say this, but my scrotum is still very irritating.
Right.
Scratching.
Itching.
Itching, really. But then the prostate side, my flow is better. I'm producing more urine about every 2 or 3 hours.
And no pain there?
There's an occasional sort of twinge, when I need to go, but nothing compared to what I've had in the last, few months.
No, there have been times when that's been really difficult.
Yes, particularly at night, So all that seems to be going all right.
It was a big shock when this all kicked off, wasn't it, really?
I mean, I just didn't know what was happening. If I couldn't urinate, and that was the initial process why I went down to A&E.
Yes.
I think there's a lot of psychological problems there too. It's because when you're a small child, your parents have to teach you, how to do it, and sometimes they get it wrong or they get annoyed or whatever it is. And I think that can get into the psyche a little bit.
Ah.
You can get guilt feelings.
That's interesting.
I'm far less neurotic about urinating than I was before.
That's interesting. So perhaps if I examine your testicles and we'll make sure that there's nothing...
If you'd like to, yes.
Okay. Let's do that. Do come through. You just give me a shout when you're ready and I'll pop through.
Right, okay. Would that be okay, I think, probably?
Okay, fine. So just pop your hands by your side. I'll just check you now. Which was the very swollen, painful
one? On the right.
There's still a bit of thickening there around the tube where it was infected.
Perhaps that's causing it, is it?
No. Scrotal itching is quite common. Can you just open your legs slightly and let's just check in your groins and... Yeah. The skin there is very dry. Do you put any moisturiser on?
I tried a little bit of almond oil.
Yeah.
And I got that E45, is it?
Yeah. Okay. Pull your things up and come on through.
Yeah, okay, thank you.
How often have you used the E45?
Well, not very often, because it's such a mess.
Yeah. Almond oil, I'm not really familiar with that as a moisturiser. So let's review where we are. You're on the right tablets to try and help shrink down the prostate and open everything up.
Okay.
I think the skin on your scrotum is very dry.
Right.
So if I were you, I would go for E45 at least 3 times a day.
Okay.
At least over the next few days.
It all seems so much better, than it was.
Yeah. All right.
Thank you very much.
Lovely to see you again, Stephen.
Bye-bye.
Bye-bye.
Thank you so much.
Indeed. Take care. Thank you very much. Take care. See you next week.
See you soon. Bye-bye. All right.
So you be healthy.
I'm afraid so. Boring advice. Yeah. Okay, take care.
All doctors should be like you.
Thank you.
Well, thank you very much, Doctor.
All right then. Bye-bye.
See you.